This module will be an introduction to EMS. We'll be going over several different publications that have kind of shaped the modern EMS, as well as the different levels and the roles and responsibilities of the advanced EMT. So the Department of Transportation published several different documents that detail out a couple of different areas for EMS. The first one is the National EMS Core Content, the EMS Scope of Practice, as well as the EMS Educational Standards. So in the EMS Core Content, they've got a couple of different things here, and they break it down. And so the first one is patient acuity definitions. Basically what this is saying how bad is the patient, what's going on with them, and it allows you to define them as either stable, unstable, or potentially unstable. And it just kind of helps make some definitions for later content. The next one, the out-of-hospital definitions. So what this does is actually go through and define all the processes that EMS are using to deliver care outside of the hospital. The task definitions. The task definitions are basically taking a listing of what EMS does, the actions that they take, and the corresponding level of acuity, whether it's critical, emergent, or lower priority, and determines in what order should you do these tasks. So basically like your BSI and SAFE for your ABCs, it's saying that it's more important to manage that airway versus splinting a broken finger. Your out-of-hospital matrix is kind of doing the same thing there. It's just making things go in order so that it helps guide your flow and modify your interactions with what you do based on how serious that patient is. Right, your procedures and skills in EMS practice, this is just a list of different procedures that they recognize are different or unique to the out-of-hospital practice, and gives some clarity to that scope of practice as well. And then other components. So this is just anything else that helps kind of validate and give guidance to the practice for emergency medical services outside of a hospital setting. And together, all of these components are designed to guide the interactions to try to minimize patient complaints, maximize patient care, and to be able to recognize the patient acuity and treat it appropriately. Your EMS educational standards. So these replaced the Department of Transportation's National Standard Curriculum at all licensure levels in, I believe it was 2002. Right? And so the really important thing and the really cool thing is that instead of some people who have very little idea of how to create an educational standard for EMS, they actually took EMS educators and people associated with at the national level with EMS and created this core content for the EMS education standards. So this should ensure that no matter where you go, they should be following the EMS educational standards so that everybody gets the same information, a bit maybe in different ways, but they get the same information needed across the board. All right. These standards also define your competencies, so everything that you need to know in order to be successful, your clinical behaviors and judgments that you need in order to be at the entry level when you finish the program. Your EMT oath and EMT code of ethics are a set of guidelines that describe personal and professional conduct that's expected of all EMS personnel. There will be a link in the course to the code of conduct there. In addition, with your EMS providers, you really need to be aware of different activities, agendas, major EMS, professional agencies, organizations. Most states have a professional organization, and there's also the National Association of EMTs, and it's really good to get involved with these because number one, you're part of a bigger organization. Number two, it helps give you a voice in the national level with laws and lobbying, and it really helps keep you current and involved in the career. The EMS scope of practice model identifies the psychomotor skills or hands-on skills as well as the knowledge needed for minimum entry-level competence. So this says when you come out of school and you get nationally accredited, this is the minimum amount of things that you need to know how to do. And that's really, the scope of practice is supposed to eliminate a lot of that variance there so that every EMS student that graduates from a accredited place should be learning the minimum skills necessary to do the job. Right, the agenda, EMS agenda for the future, basically what this does is it takes and it says this is what we want to do and this is how we're going to achieve it. And so it really says that they want to grow EMS from kind of a baby profession to a full profession with more possibilities in the future, especially focusing on mobile integrated healthcare as well as community paramedicine and home healthcare. Your EMS provider levels. There are 4 nationally recognized levels of EMS providers: the EMR or emergency medical responder, the EMT or emergency medical technician, the AEMT or the advanced emergency medical technician, and paramedic. Now, your emergency medical responders, they are trained at the minimum level. They provide your simple, your non-invasive treatment, and this is basically looking at your life threats, CPR, AED, bleeding control, basic airway stuff, and then manual immobilization of C-spine as needed. Your EMTs, they provide your emergency care and transportation using your basic equipment, and really depending on where you go depends on what role they provide in the EMS system. They are trained to assess the patients and provide care based on that assessment. Some areas utilize EMTs, and EMTs will actually be the highest level on the truck and will be transporting patients. Other areas, the EMT may primarily drive and assist the paramedic or advanced EMT with patient care. Advanced EMT, all of the training from your EMRs and EMT, but also gives a limited number of your advanced life support. You get blind airway insertion, IVs, some medications, IO. So you get a little more invasive skills and with the advanced life support interventions. You still have to practice within your scope of practice though. For paramedic, these are your healthcare professionals who do complete complex assessments, interventions for critical and non-critical patients. And to be a fully functional paramedic, you really have to have a more complex understanding of your anatomy and physiology and pathophysiology of what's happening with the patient so that you can understand what is going on there with the patient. So your roles and responsibilities for your advanced EMT. Your authorization to practice. This is based on a couple of different things. The first of which is the state legislation. So most states, you have to have a state license as well as the national certification to practice as an advanced EMT. There are employer policies and procedures. This is more of maybe passing a physical fitness test or passing a background check or something like that, drug screens, that sort of thing. And then guidance by a physician, medical director. Just like with your EMTs and your paramedics, you do have to be covered under a medical director. So the medical director has to basically vouch for you and let you work under their license to distribute the medications that's in your scope and perform the skills that are in your scope of practice. All right. So some things that we want to look at here: your emergency vehicle readiness and operations. This is pretty simple. If you're going to be in an ambulance responding to calls, it needs to be in good repair and driven safely. It's part of your job to make sure that happens. We also want to make sure that it has adequate amounts of the equipment and supplies that we need to do our job. For safety, this is really kind of an overall across the board thing, but it's safety for everyone. It's our own personal safety, safety for our coworkers, our partners, our patients, and bystanders. And it goes in that order: yourself, your partner, your patient, your bystanders. It includes your safe medication practices, and we'll talk more about those with medications, but safe medication errors are one of the top malpractice suits. Being aware of public safety when you're operating an emergency vehicle, when you're going to and from an emergency scene, when you're at an emergency scene, being safe. Everything from somebody with a gun to stepping out of the ambulance and not stepping into a hole. For your scene leadership, this is really something that some people come in innately with it and some people don't, but you've got to be confident, you've got to be in control of what you do, and you've got to balance being confident with being empathetic to the needs of the patient and the family members, and sometimes that can actually be more difficult than understanding what's going on with them medically. Another part of this management here is your patient assessment. You have to understand a wide variety of medical problems, traumatic injuries, and understand what's going to happen in the body and how to fix it. so that you can appropriately manage that patient. You also need to be aware of your surroundings and where the most appropriate transport place may be based on that patient's acuity. All right. Another thing is staying current. Things do change. 10, 15 years ago, tourniquets were not used. They were discouraged and they were the last thing you wanted to do. Now, that bleeding doesn't stop pretty quickly, you go into a tourniquet. So it really just depends. You got to make sure that you're staying current with your practices and staying up to date and knowing what the current practices are. And then along that same vein, being willing to get rid of the old knowledge and practice and try the new ones. Maintaining licensure and certification is an individual responsibility that does not belong to the agency, although some agencies do assist you with that. It depends on where you are, what your certification requirements are. But for a national registry, they actually detail out in a pamphlet what is every hour, how it breaks down what you need to continue your education. And it breaks down into hours per usually a 2-year renewal cycle. And then working with public safety, we've all met that one person who can't get along with anybody and everybody kind of goes when you see them. Try not to be that person. We're going to have to work with other professionals. You've got to work with both public safety, police officers, fire departments. You're also going to be working with healthcare providers, doctors, nurses, nurse practitioners. So you don't want to look dumb. You don't want to look like an unfriendly person. So make sure that you really just strive to have cooperative, be personable, have a cooperative relationship with other professionals, and behave in yourself in a manner that's becoming to the profession itself. All right. With professional characteristics, there are some things that they have come up with that they say are really things that we need to make sure that we are working on. So these characteristics are defined by expectations of the public. The public has a reasonable expectation that you will be professional when they call 911 and you show up at their door or their car or wherever they may be. And if you think about it, I don't want somebody who shows up with their pants dragging the ground, shirt half untucked, dirty, hair looks like they hadn't had a shower in a week. I'm not going to feel that they are on the top of their game. The professional group itself, EMS, we have certain characteristics that we feel like are very important. Other professional groups, nurses, doctors, other people that we deal with. And then, the biggest one is how the patients and their families see us, how we interact with them goes a long way to our professionalism and how they perceive us as a whole. So the things that they really looked at for your characteristics here: integrity. Integrity is super important. Without integrity, you have nothing. Right? Integrity means if you answer on scene and you have a patient's money sitting there, they shouldn't have to worry that their money's going to disappear. It should go with them, and every penny of it should be accounted for. It should never cross your mind to take it. Empathy. You don't have to be sympathetic for the patients necessarily, but you need to have empathy for the patients. That allows you to care for them. Self-motivation. I can't make you want to take a shower every day. Neither can anybody else. We've got to have a certain degree of self-motivation in order to get up and do our jobs appropriately. There's a difference between doing what's appropriate for the patients and doing what's minimally required. All right, appearance and hygiene. Take a bath. Be clean. You don't need to wear anything excessive perfumed-wise. Some people have very severe allergies. It can trigger headaches. You can trigger a full-blown anaphylactic reaction with some heavy perfumes or body washes. So you want to make sure that you're not causing any undue harm to these patients. Self-confidence is important. If you don't believe in you, why should the patient believe in you? So, it's very important to have that self-confidence there. Being able to communicate is very important. We communicate every single day whether we realize it or not. And this breaks down with both verbal communication and physical communication, and even could include some documentation. So communication and the ability to do so is very important. Time management. Time does some weird things sometimes when you're on scene, and what's a minute can feel like 20, and sometimes 20 minutes can fly by and it feels like it's been 2. So it's really important to make sure that you keep an eye on the time and be able to manage your time so that we can get the patients treated appropriately and on the way to the right place. Teamwork speaks for itself. You've got to be able to work with other people. This is not a solo endeavor. You will almost never be on a truck by yourself because somebody else has got to drive it if you're going to be in the back. Patient advocacy, that's what it all boils down to at the end of the day, being your patient advocate. We have to be the ones that stand up for the patients no matter what, because we may be the only person in a position to see what they're coming from. And then, of course, carefully deliver a service. You may know everything there is to know and be able to memorize straight from the book an entire chapter on how to do something. But if you can't do it appropriately, what good is it? So these are all the professional characteristics, your roles, responsibilities, and then your EMS system introduction.